Today, we are here to learn about prosthetic associated biofilms and their prevention methods. In the parallel universe where Dr. Vasikaran and Iron Man know each other, Dr. Vasikaran is a biophysicist known for his excellent take on robotics. Last year, he had invented Chitti, a robot who was exactly a human replica. Tarun is a first-year physics student interning in the lab of Dr. Vasikaran. And yes, I am Tarak Mehta of this universe. Let's go to the Vasikaran lab. Today, we are getting an opportunity to go inside the lab. Aren't you excited?
वणक्कम काय मग पाहुणं कसं काय It is so great to see Iron Man here.
Namaste, sir. I am so inspired by your work and the human-like Chitti robot. I am constantly performing prosthetic surgeries on people for past many years since Thanos caused destruction on our planet. Almost all these surgeries had gone well. I have replaced legs, arms of those people who have lost them.
Chitti chitti robo, oh chitti chitti.
Great man, you and your team are really great surgeons. I know the way you'll design those prosthetic arms and legs and also the pacemakers. I saw it on news. It's so amazing. All these 21st century gadgets are.
Yes, sir. I am a great fan of Iron Man.
But one of the prosthetic knee joint infection garnered my attention. We had performed this surgery few years back with utmost care. The sterile protocol was totally followed. We prescribed antibiotics to the patient, but it didn't seem to work. Google didn't help me, so I went to Doctor Strange. Doctor Strange told me that this resistance against the antibiotics was due to the biofilm formation by the microorganisms at the site of surgery. Then he recommended your name to me, and guess what? I am here.
Vasikaran, sir. I know of these prosthetic organs. They are artificial organs that can be implemented or integrated into human body, interfacing with living organs. To replace a natural organ lost due to various reasons, I have seen our para-Olympians using them and making our nation proud. What is this biofilm? I have never came across this word.
Bachcha, in microbiological terms, a biofilm is formed by microorganisms. It is usually an assemblage of microorganisms, that is, bacteria, fungi, viruses, on a solid surface. In case of bacteria, they are either sessile, that is, biofilm forming, or planktonic ones, which are free living, that do not form biofilms.
Thank you, sir. I understood. But how do these bacteria come together? What are the extra characteristics conferred upon these biofilm associated microbes?
The biofilm formation takes place in a series of stages. First is bacterial attachment stage, in which planktonic bacteria attach to a surface. These surfaces can be abiotic, such as mobile screens, medical equipments, and biotic, such as living tissues. Second is the microcolony formation stage. Extracellular polysaccharides make the separation of bacteria tougher. Third is biofilm maturation stage. In this stage, the microorganisms form channels and exchange material such as metabolites. The fourth and the final stage is detachment, dispersal of bacteria from the biofilm. Now the bacterium can go to the other surfaces. In a biofilm, the microorganisms can exchange the genetic material known as horizontal gene transfer, in which they exchange their DNA, also plasmids, and hence acquire antibiotic resistance. Samjha? Are you there? Are you there with me?
हाँ sir, it seems interesting. So the microorganisms are like, ये दोस्ती हम नहीं तोड़ेंगे. But this biofilm formation might be taking a lot of time. Sir, now I have a doubt. How does it affect surgeries? Sir, can you tell me which prosthetics are prone to biofilm formation?
Tooth implants, contact lenses, orthopedic prosthesis, pacemaker, etc. And yes, biofilms are not only found on prosthesis but on the bones, fibrous tissues, synovial fluids, associated with the prosthesis. Yes, man. But we had followed all the sterile protocols. I did listen, smile, agree to the other surgeons, and didn't do whatever I was gonna do. अगदी तंतोतंत protocols पाळले तरीही असे does happen. There are several reasons. The majority of prosthetic joint infections occur within 1 year of surgery, which are initiated through the introduction of microorganisms at the time of surgery. This can occur either through direct contact or aerosolized contamination of the prosthesis or prosthetic tissue. A low inoculum of microorganisms is enough to establish infection in the presence of prosthetic material. In the early postoperative time period, superficial surgical site infection can progress to involve the prosthesis due to incompletely healed superficial and deep facial planes. These infections can contiguously spread from the adjacent site. Erosion of the implant through an impaired soft tissue envelope may also dispose patients to a late onset of contiguous infection. The truth is, this biofilm formation process starts within few seconds of exposure and is mediated by multiple factors. So, doc, which microorganisms are associated with this biofilm formation? Post-operatively, it depends on the onset of symptoms. Usually, if it's less than 3 months from the surgery, it's due to the virulent microorganisms such as gram-negative bacilli, that is E. coli, or S. aureus. If it is caused later, then it can be due to coagulase negative staphylococci or Propionibacterium ignis, and so on. Yes, these infections caused can be both localized as well as systemic.
So, Iron Man, what signs did you observe in the patient?
In a year of surgery, the patient had a pain in the prosthesis, and it was followed by a wound drainage over the joint. Doc, how can I confirm which microorganisms are present in that biofilm? PCR, ultrasound, advanced biofilm imaging, these techniques would work. How can one manage the biofilm? Antibiotics like rifampicin, bacteriophages, enzymes like DNases have shown significant efficiency in treating these biofilms.
Doctor, can it be prevented?
Yes, modification of the implant surface, such as active coatings, which includes pre-incorporated antimicrobials to combat infections, or passive coatings which impede bacterial adhesion and or kill bacteria upon contact, or novel strategies such as vaccines. I hope, Iron Man, it helped you. Yes, thanks for being so super doc. Now I know my next move. Enrolling in an university to do my biology majors. Ha 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 ha. Just kidding. Auf Wiedersehen to both.
Thanks, doctor. Learned lots of microbiology today. Just making a note of things. क्या पता, if I get a chance to write a script for Sholay 2.0, ha 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 ha, in which Thakur has a hand implant so that Gabbar Singh has a tougher fight this time. Maybe in this part we can include biofilms also.
I hope the perspective of a biophysicist might have helped you to understand this concept. Welcome to you both. All the best. So, microbiology students, I hope you understood the prosthetic associated biofilms and their prevention methods. Thank you. Bye. Take care.